Hello and welcome back to my channel. Today I'm going to go over some things that you can eat directly after your dental implant surgery. Now, if you've had all your teeth removed and you had all new uppers and lowers installed like I did, you're not going to want to eat much of anything directly after your surgery because your mouth is going to be pretty sore and pretty swollen, and you haven't eaten all day, but let me tell you, you're not going to want to try and eat anything directly after, at least. They said you can have a liquid diet for the first 3 days, and you want to really stick to liquid items. Liquid being water, milkshakes, soup broths, things like that. You don't want to really get into too much else in the first 72 hours following your surgery. Now, the following 3 to 7 days after, they said you can get into some mushier food items, such as mashed potatoes, yogurts, mashed bananas, fruits, steamed vegetables, things like that. That would be of a more soft consistency. And then after 7 weeks, you can maybe start getting into some other softer foods, but I wouldn't risk anything hard for at least 4 to 6 weeks following your surgery. Just take it lightly and go slow, and definitely follow the recommendations from the dentist, because that's what I did and it worked really well for me. By strictly sticking to stuff that's soft, pretty much the first 4 weeks, and I started getting into some harder items, burritos and things like that. But I lived off of, for the first month after, pretty much I lived off of scrambled eggs, mashed potatoes, yogurts, ice cream. Ice cream was a big one. I really liked ice cream because that helps soothe some of the spots in your gums. Another tip I will tell you is get some ice packs, some good ice packs to help some of the swelling afterwards. It does relieve the swelling that you might have. At least it did for me, and it soothed some of the pain that I had. Hopefully that's good advice. There's other food items that you can try out that I didn't necessarily try, but they do have a list of different things that they'll give you at the dentist, and you can go from there. Now, you are going to have sutures in your mouth still, and you might feel little strings here and there, but they will dissolve. Mine dissolved 2 to 4 weeks after the surgery, but I did have some for like a month still in there, but they didn't affect eating or any of the items that I can eat. The swelling in my gums went down pretty much the first following days after, so you're kind of back to normal after about 3 to 4 days. You're starting to feel better, and you're starting to feel like you can eat some more variety of foods, but definitely take it slow. Don't go into nachos and gum and hard candies right away, because you will, chip away these things. Now, they do say that your bite's going to get kind of grinded down a little bit as you start eating harder foods, and that is normal, and that's your bite just kind of accustoming itself and getting it down to where it's supposed to be. And yeah, so that is some of the food items that you can eat directly after your surgery, and don't risk it. I am right now 9 weeks post-op, and I'm starting to enjoy food items that I haven't enjoyed for years, because it was just, I wouldn't be able to eat them. I would be in pain if I tried to eat them. But now I can finally eat some normal foods like a normal person. So I am just absolutely thrilled to be able to start eating normal items again, now that I feel comfortable with my new smile, my new bite, and I have an appetite to eat stuff. So let me know if you have any questions, and I will get into other topics in some other videos coming out here. If you like this video, go ahead and click subscribe, and we'll catch you on the next one. Thank you.